For a long time now, people have been transfixed on intersex conditions. Ever since the 60s, people born intersex were often regarded as needing to undergo sex reassignment surgery, the decision being left to their parents. However, these surgeries were not nearly as simple as de-hooding your king cobra. It wasn't until the 1990s that survivors of these surgeries started speaking out against the practice and the trouble it had caused them. Researcher Dr. Jameson focused on how these pre-puberty assignments affected children.
So the topic of sex change surgery has been pretty popular in modern day research. Unfortunately, there's comparatively little being done on intersex kids. Despite this void in knowledge, the majority of states actually allow parents to put their children through this transformative process. However, what has been found so far is that self-identifying intersex prepubescent children will typically no longer experience this identity once they've gone through puberty, instead of identifying themselves as non-heterosexual. In fact, our estimates indicate that 80 to 95% of intersex kids will follow this pattern.
At the centre of this argument is this: kids are stupid, parents are stupider. Kimberly Zeiselman, Executive Director of Interact, the only intersex youth advocacy program, and a writer for USA Today, thinks it's important for people to know that making a choice for kids has not only mental but physical repercussions. Kimberly Zeiselman, why is intersex advocacy important to you?
Well, Jim, I was born with typical male XY chromosomes, which meant that I had testes in my body instead of ovaries. However, my body has androgen insensitivity syndrome, which means that my body is resistant to androgens, like testosterone, which meant that when I was born, I appeared to be externally female. And so my parents didn't really learn of my intersex condition until I reached the age of about 15, and I wasn't developing through puberty or menstruating like the other girls my age. And so upon learning of my condition, my parents allowed doctors to operate on me to remove my healthy gonadal tissue, i.e. my testes. And so this procedure meant that my natural hormone production ceased, and I had to be placed on permanent hormone replacement therapy for the rest of my life. But I didn't learn about all this medical information until I reached the age of 41. I didn't learn about this until I was 41 years old. And sadly, this is the case for so many intersex individuals, which is about 1.7% of the population. And so all of this really inspired me to join Interact and really get involved with their work. And the most recent accomplishment of this organization was the joint publication with the Human Rights Watch called I Want to Be Like Nature Made Me: Medically Unnecessary Surgeries on Intersex Children in the U.S., which examines the controversy among intersex surgical interventions on children and the physical and psychological effects of such interventions. And this is so necessary now because doctors are continually suggesting these medically unnecessary procedures to the parents of intersex youth.
Clearly, this non-consensual procedure was unwanted and unethical to perform. However, what if kids are suffering from an incongruency because of their ambiguous genitalia? Are they just supposed to wait until they're 18 to be able to make their body and mind align? Dr. Jameson proposes a healthier alternative.
However, this does not suggest that no therapy entirely is the best option. For the remaining 20 to 5% of intersex kids who do retain this identity beyond puberty, early initiatives have been shown to be beneficial. Hormonal therapy, for instance, can help these young children feel more comfortable in their bodies, with results that are easily reversed, in contrast with the permanent nature of surgery.
These surgeries not only put children at risk for being assigned the wrong gender, but they can also put children at risk for suffering things like infertility, incontinence, lack of sensation, psychological trauma, and scarring that could prevent any future operations. There's also insufficient evidence that says that having children grow up with ambiguous genitalia actually causes psychological trauma. What the evidence does show is that performing these non-consensual surgeries on children does cause psychological trauma and physical damage to the body. It is much safer to wait for surgical interventions because once they are done, their effects are irreversible and they're lifelong. I was lucky in that my parents opted to not have doctors performed cosmetic surgery on my external genitalia to quote-unquote normalize it. However, there's so many children around the world who are not as lucky as I was. Through my work with Interact, I can proudly say that these kids are perfect. They are just fine, just the way that they are. And our bodies are neither shameful, nor do they need to be fixed as deemed by the binary culture. It is critical that children are allowed to participate in the decisions on the interventions that are done onto their bodies.
Bottom line is this: don't fuck with your kids' bits, even if they really want you to. If little Johnny wants to be a peg leg pirate for Halloween, you don't chop his fucking leg off, do you?